And could it be muted too? Yeah, okay, thanks. Okay, so I'll probably just give a thumbs up. Okay.
Okay, it's 9 a.m. now. I'm going to give a countdown from 5 and then we'll start the webinar. So starting the webinar in 5, 4, 3, 2, 1.
Hello, good morning, good afternoon, and good evening. My name is Miriam Sabin, and I am the North American Senior Executive Editor for The Lancet, based in New York City. And it is my absolute pleasure to welcome you to the important discussion today on the social responsibility of medical and scientific journals, presented as part of the Lancet Commission on Public Policy and Health in the USA. This webinar series, which has been recorded over the past year, has brought some of the most important, yet sadly neglected topics and health issues for discussion. And we've done this with outstanding speakers and stimulating discussions. If you enjoyed today's webinar, I encourage you to look at the rest of the series. I'm sure you won't be disappointed at all. And with that, I'd like to hand over to Dr. Mensah. Thank you.
Thank you, Editor Sabin. Hello, everyone. Thanks for tuning in. My name is Michael Mensah, and I'm a psychiatrist, JAMA editorial fellow, and member of the Lancet Commission on Public Policy and Health hosting this webinar. We organized this webinar in light of calls for leading medical and scientific journals to engage more with social issues crucial to health and healthcare around the world. 3 editors accepted our webinar invitation. I could devote the entire hour to describing our speakers' distinguished careers, but in the interest of time, I'll just hit some of the high notes. Valda Vinson has served as the executive editor of the large family of science journals, including Science itself, since 2022. She earned a master's degree in chemistry from University of Natal, South Africa, and a PhD from Johns Hopkins University, where her postdoctoral research focused on structural and biochemical studies of cytoskeletal proteins. Before joining Science's editorial staff as an associate editor in 1999, she served as senior lecturer at the University of the Western Cape in South Africa. Welcome, Editor Vinson. Richard Horton has been editor-in-chief of The Lancet since 1995 and also oversees its large family of journals. After studying medicine at the University of Birmingham, he joined the liver unit at London's Royal Free Hospital. He is an honorary professor at the London School of Hygiene and Tropical Medicine, University College London, and the University of Oslo. Thank you, Editor Horton, for coming on the seminar. Kirsten Bibbins Domingo is the 17th editor-in-chief of JAMA and the JAMA Network. She is the Lee Goldman, MD, Endowed Professor of Medicine, Epidemiology, and Biostatistics at the University of California, San Francisco, and is also a general internist and cardiovascular disease epidemiologist. She's a national leader in prevention and interventions to address health disparities. Thank you for coming, Editor Bibbins Domingo. Just a brief summary of what we're going to be talking about, or the agenda. Each editor will make a presentation of about 12 minutes, just talking about their vision for approaching these social issues. And then I will ask them questions submitted by the audience before the session. So now we have Editor Bibbins Domingo, who will present first. Thank you.
Thank you very much, Dr. Mensah. It's a real pleasure to be here, and thank you for the invitation to join this panel and for organizing a panel on such a very important topic. So I assume everyone can see my slides, yes? Okay, so I really am I'm thrilled that you have organized around this topic of the social responsibility of journals, and I'm going to speak from my perspective as the editor-in-chief of JAMA and the family of journals in the JAMA network, the 13 journals of the JAMA network. So let me start with what I think are our starting assumptions about this. Here's what we know. We know that the social context matters for health, it matters for the practice of medicine, and it matters for the conduct of science. And we also know that systemic and structural factors that shape this social context and contribute to the underlying inequities also directly contribute to differences in health, differences in the practice of medicine, and differences in the conduct of science. And so that means that as journals who care about publishing the science that influences health, we have to care about the social context in which all of this happens. So it's part and parcel. So first, I would say that the way that this is constructed is exactly how journals have to be thinking if we are to do our job. This is not separate and something we do on top of our day job. It has to be part and parcel of what journals do if they're to be most effective. The second set of things that we know is that journals have considerable power. We hold that key to having ideas, new innovations make it out into the rest of the world. We hold power because of our contributions to what authors submit to us and how we ask questions about what's submitted to us, how we choose to publish what's submitted to us. And I would say the big journals, the journals you have on this call today, have considerable power because not just is it the gateway to being able to communicate something more broadly, but also it carries extra weight when journals of this stature decide to publish something. It means it has particular importance for science, medicine, public health. And journals are also shaped then by the same social construct, the same systemic factors that contribute to the inequities, the social inequities that we see also affect the journals. So these are the starting assumptions. And this is how I came to my position. What both intrigued me about being an editor-in-chief when I left, took a leave from my academic position to become editor-in-chief just over 2 years ago. This was the editorial that we published when I started, and really speaks to what I think is the central tensions for journals, and that is that journals themselves have the ability to both, when we take our social responsibility seriously, we have the ability to have a disproportionate impact on the fields that we care about. And when we don't sufficiently acknowledge that we ourselves are part and parcel of this, we then can contribute to social inequities that we see and are important for the conduct of science and the practice of medicine. So when journals become more insular, more parochial, these are real threats that we have to guard against. They're threats that inhibit us from recognizing the importance of a particular scientific contribution, or that threaten the ability of that contribution to lead to improvements in health. And we guard against these threats via editorial policies, but we also have to guard against these threats by ensuring that we have the types of voices in the room that represent the diversity of thought, expertise, and backgrounds that allow us to understand what science can be impactful for health. And we know that voices of those who've been historically marginalized and excluded from science and medicine have also been largely absent from scientific and medical publishing, and this is to the detriment of all of us. So we've really focused on sort of asking this question about who is in the room, whose voices are being heard, and how can we ensure that we as a set of journals always make sure that we have more voices in the room. Here, ensuring diversity, this is not simply an issue of fairness and equity. It is about accelerating advances in science. It is about producing better medical journalism. It's fundamental to the trust that readers place in journals to deliver the highest quality content. What we have done, I'm just going to go through a few of the ways we have tried to live up to this commitment that we have. And I'm going to start first with just thinking about who's in the room at JAMA and the JAMA network. So earlier this year, we published, we always publish our mastheads, but we published the demographics of the editors and the editorial boards of our journals. We had made this commitment earlier, but we acted on this commitment to make sure that we also were using rigorous methods to actually communicate about the demographic characteristics of our editors and editorial team. The external communication was about living up to our commitment and the transparency to allow others to see into our process. But I would say the exercise of doing this was as important for our internal processes, for us as editors to ask whether our editorial teams and our boards really reflect what we want to have in terms of the range of voices we want at the table, contributing to the discussions that we want to be able to publish on the pages of our journals. So it inspired as much internal reflection and then changes as it has, I think, external discussion as well. So the people are important, and the people are not just who are in the room and on our Zoom screens and our team screens. They also are how we choose our peer reviewers, how we choose who writes editorials on our work, how we make sure that authors who are published in us are as transparent as they can be in the types of positions and potential conflicts that they themselves have. Each of our journals has an editor who is an editor focused on equity. And the goal is not for that editor to solely carry the issues of social responsibility on their backs alone, but that there is always a voice in the room that is always looking out for the issues that might come up in an individual paper or an individual set of decisions that are being made. That editor is part of the team. They're not separate from the team. And they also, we have the luxury of then working together across the journals to sort of build more community around and accountability around how our journals can be the best that they can be in this regard. It is certainly about the processes because we have to have processes that are fair and equitable, processes that people can look to, and people can also challenge us on when they think we haven't lived up to our responsibility. So I would say the editorial processes are as important and work together with the people who are in the room to ensure that that we have the types of voices contributing to the decisions that we make. And we take this seriously as well. And then lastly, I would say it is about the content. It's about the things that we choose to publish, and it's about the way in which the manner in which we publish them as well. And one of the things that has been very clear to us is how much interest there is in journals being very intentional about their social responsibility. We have a weekly email that now goes out that highlights content along these topics that it has become a very popular email subscription from our network of journals. So I'll just give you an example in the end of three ways in which we have thought about this just in the past year. So this is a call for papers on health in the US election that we issued at the end of 2023. We've published, I think, well over 100 papers or nearly 100 papers on topics, both original investigation as well as commentary that relates to issues both local and national in the US elections. And obviously, as we get closer to the elections, look forward to continuing to highlight on this topic. we have published quite a bit on giving guidance to authors on those areas that are particularly at the intersection of how we of issues that relate to the social context and the conduct of science. This is a guidance that we published earlier this year with several other journals. Our editors took the lead here on the use of race and ethnicity and geographic origin as proxies for genetic ancestry groups in biomedical publication, and guidance for how to, this is a complex area, and I think journals have a voice in helping to bring guidance and hopefully clarity to allow more authors to be able to communicate in more effective ways on complex topics like race, social constructs, and genetic ancestry, which is an important area of scientific investigation as well. And then most recently, and I'm highlighting this because it is open for public comment, we've issued our draft guidance on reporting gender, sex, gender identity, sexual orientation, and age in medical and scientific publication. We've had a lot of input from experts in the field who are calling, who helped us to develop this guidance document, and it's now open for public comment as well. An earlier guidance like this that we published on race and ethnicity and geographic origin has been very popular, that we published in 2021. So I'll just end by saying that this is a journey towards always living up to our goal of our social responsibility. It is not something, I come to this with a lot of humility. It is not something that is a finished product. One of the things that I've been really thrilled at is to have people like Dr. Mensah, who's as a part of our JAMA editorial fellowship team, because I think continuing to push our journals to be the best that they can be is as important as the things that we already have in place. And so I'm looking forward to the discussion.
Great. Thank you, Dr. Bibbins Domingo. I appreciate the iterative and in the ongoing evolving nature of what you just presented, especially the transparency of the process. I think that's incredibly important. And also the fact that you started with first principles and then went and explained your reasoning from there. I think that's something that is quite patently scientific. So now we're gonna have Editor Horton present, and thank you, Editor Horton.
Thanks very much indeed, Michael. I hope everybody can hear me. It's great to be with you. Let me start off. I don't have any slides, so I'm just going to talk for a few minutes. Let me start off by just asking a question of what's the point of all this? What's the purpose of what we do in accumulating scientific knowledge? And given that I'm here sitting in London, an answer came in 1751 at the birth of the Enlightenment in Europe. It came from a French writer, Jean d'Alembert, who in his introduction to Diderot's great encyclopedia, which was emblematic of the Enlightenment, he wrote that the accumulation of knowledge should, and I'm quoting now, contribute new advantages to society as a whole. In other words, knowledge should have a social purpose. And so if we're thinking about this question today, the role of a journal, the role of an editor, we should be asking ourselves, how can we contribute new advantages to society? I certainly struggled with that question until a day in 2002 when this remarkable woman called Jennifer Bryce visited us at the Lancet. She is, or at the time was, an epidemiologist and public health scientist at UNICEF. And she was outraged at the neglect of child survival in the world. And she invited us to commission a series of papers to expose this neglect, to reveal the true global toll of child mortality, to show what could be done to reduce that mortality, and to publish a call to action to do so. Over the next 5 years or so, we published series like that, combining science with a call to action in newborn survival, maternal health, adolescent health, sexual reproductive health, publishing metrics, causes of death, proposals, plans, strategies for how to address these particular challenges. In other words, trying to build a unified scientific community that had a clear and consistent set of messages. And in a small way, and I don't want to overclaim, but in a small way, that helped to contribute political confidence to investing in women's and children's health during the era of the Millennium Development Goals. It certainly gave Secretary General Ban Ki-moon in the UN confidence to launch his signature health initiative, Every Woman, Every Child, for the creation of a global strategy for women's, children's, and adolescent health, and even to encourage certain G7 leaders to step forward and lead major political initiatives in support of women's and children's health. So this experience during the 2000s really showed us what a scientific journal can be. Much more than a news magazine, much more than a repository of research, and much more than a mirror of medicine. It could be, on the contrary, a provocative instrument to catalyze and encourage social policy, even political action. Now, following on from that, we wanted to do more. And what struck us was that there were two challenges facing us. First, the complex health challenges in the world today demanded complex multidisciplinary solutions. And the second challenge was that our universities represented an untapped resource for those multiple disciplines. And the trick would be, how do you tap into that resource within universities in a better way? And the answer that we came up with was the notion of a Lancet Commission. It was an inquiry and a manifesto for action into a particular challenge. The very first commission we published was in 2009, was with University College London, and it was on climate and health. And the bottom line message of that commission was that the climate crisis was the biggest threat to global health in the 21st century. Not a surprising lesson now in 2024, but back in 2009 was a relatively controversial thing to say. And since then, we've published over 140 clinical and global health commissions. And this has been, for us anyway, at the Lancet Journals, a transformational experience, established long-term partnerships with scientists and institutions across the world. We have a program planned over the next 3 to 4 years. This year, just in July, we launched a third iteration of our commission on dementia, showing how if you intervene on a whole array of different risk factors, you could prevent up to 45% of future cases of dementia. Just in a few weeks, we'll launch a commission on self-harm at the World Health Summit in October, commission on investing in health, looking at the future of global health beyond 2030 and the Sustainable Development Goals out to 2050. Another climate report, which I'll have a little bit more to say about in a moment. And then a theme issue in November after the US election, which actually Miriam, who introduced this webinar, is leading for us. And she coined the idea of a presidential briefing book for whoever the new president is, trying to bring together relevant evidence about US health and healthcare into one issue that might sit on the desk of the new president in the Oval Office. We can only hope. Now, the key to success of these projects isn't really the publication itself. It's what comes afterwards. It's afterlife. And let me just give you one example of that. So I mentioned the Climate and Health Commission in 2009. We did another Climate and Health Commission in 2015 to really try and reinforce the point about the climate emergency, but also to say that it wasn't just a threat, it was also a fantastic opportunity that if we seized it, this could have major benefits, co-benefits for public health. We also launched a commission with the Rockefeller Foundation on planetary health, the health of human civilizations and the natural systems on which they depend, a journal on planetary health. And then the final phase was launching the Climate Countdown. And the Climate Countdown is a Wellcome Trust funded initiative. We publish an annual report every year. It's an accountability mechanism monitoring a collection of about 40, 45 indicators across climate and health, reviewing progress, and feeding into the Conference of Parties meeting at the end of each year, the COP meetings, where health has gained an increasingly important role. Wellcome Trust has just issued a grant of over £20 million to keep the countdown going over the next 4 to 5 years. We have regional countdowns, all stemming from that very first Lancet Commission in 2009. Now, our goal comes from a phrase that isn't ours. It's actually from the great American, sadly deceased philosopher John Rawls, from his 1971 book on the theory of justice, probably the biggest contribution to the philosophy of justice for the past century, maybe even since the Enlightenment itself. And John Rawls's phrase was the idea of a realistic utopia. There have been lots of aims to create utopias, and they've all failed. But what about a realistic utopia? The idea that we can extend the limits of possibility of our species and to insist that this possibility can be achieved, it can exist. And that's the idea behind a Lancet series or a Lancet Commission, trying to put knowledge together for a social purpose, trying to create that realistic utopia. In all honesty, there's nothing new about this. The Lancet's founding editor was somebody called Thomas Wackley. He was not just a doctor and an editor, but he was also a member of Parliament. And he saw that some of the greatest advances in health in his time in the 19th century came from political engagement, and that medicine was a transformative resource in society when put to that political use. So all we are doing today, the editors in the 21st century, all we are doing is trying to interpret Thomas Wackley's vision for our times. Just a final word. The reason why we're also committed to this vision for what science can achieve, an instrument for social action and political change, and what a journal can do in convening the smartest people in the world together to work on these ideas for a realistic utopia. The reason why we're so committed to this vision is that progress is not inevitable. And the pandemic showed that. We can go backwards as well as forwards. We can have de-development as well as development. And so we are engaged in a great struggle of our time to address some of the most damaging forces shaping our lives today. Populism, nationalism, authoritarianism, crushing press freedom, movements of anti-science. These threats are considerable, and we see them all around us. Conflict and violence, ecocide, disinformation, poverty, disparities, racism, and the risk of future pandemics. And our belief, our commitment is that medicine and the medical science community has an absolutely pivotal role to play in mobilizing the knowledge that we publish, indeed bringing people together to create new knowledge with a very clear objective of health, for health, but not only health, for health equity and for social justice. So that's our hope and vision and commitment for our future. Thank you very much, Michael.
Thank you, Editor Horton. I really appreciate the John Rawls reference as well. I mean, I think that's extremely important. And honestly, I think the first commission on climate change, the fact that used to be controversial, but is now given knowledge is a great example for what these journals should aspire to. And so with that, I'll transition to Editor Vincent. Thank you and welcome.
Thank you so much. And thank you for inviting me. I'm just so honored to be on this panel. I'm going to start sharing my screen. And hopefully that worked. So thanks so much. It was so interesting to listen to the past two talks, and they reflected so much of what we are thinking about at the science journals as well. So just to give a little context, I'm executive editor for the science journals, and we have 6 journals, of course, Science, and then also Science Advances, a large open access journal, and our 4 more focused journals, including Science Translational Medicine. And we're published by AAAS, and sort of, which is a scientific society with this mission of basically advancing science and serving society. So this idea of science for society is intrinsic to AAAS, and so it is a goal of a mission of the journals that's inherent in who we are. So this is a slide that our editor-in-chief, Holden Thorpe, often shows, and what it's saying is that, although we always talk about the erosion of trust in science, which is absolutely true, trust in scientists is still high, but not in the policy. It's sort of, so if you look at, medical scientists are quite trusted, scientists are quite trusted, and then, but yet when you look at sort of science policy, there's sort of this mistrust of science, and this idea that scientists should stick to science and not be commenting on policy or social issues. And of course, we think that's completely false, and that science absolutely is an integral part of society and has to have a place in politics. These things just can't be separated out. But yet there is a real danger here, I think, also, because if you look at where we've come from, where science was celebrated, we got to the moon, this was a huge endeavor. It was seen as this big scientific mission. There wasn't really so much one individual tied to it. And yet now we've got to a place where science is attacked by attacking individuals. And as we saw, of course, with Dr. Fauci, and this is a vulnerable. This makes us vulnerable when what the anti-scientists can do is target individuals rather than targeting the scientific process. But of course, we all know science is a process, not just a set of facts. And those of us who were at the journal through COVID really saw that play out. But even beyond that, scientists, it's part of a healthy process of science for scientists to debate each other. The difference now is that the public can see that. And the public, which is good. I think transparency is a great thing, but it comes with a lack of context where people cannot not necessarily understand that this is really part of the scientific process. Scientific research is by design challenges assumptions, but what is seen is the challenging and not necessarily that this is part of a process. And also that we say what we know now, understanding that this is going to change. But again, as it's presented, the public doesn't necessarily understand that. So we have this great challenge to really contextualize better what science is. And I think in this, briefly talking, I mentioned briefly these attacks on science. And we see that this stick to science is still very much a talking point. It's been there, since people attacked, in the attacks on global warming, in the attacks on the ozone hole, in the attacks on tobacco, on anti-tobacco industry. There's always been this stick to science. And this is still very much alive. Holden Thorpe wrote about this in a 2020 editorial. We had another recent editorial saying that, understanding the nature, causes, and solutions to human problems is a primary goal, and science is clearly relevant to the controversial issues of our time. In fact, science is especially critical in these moments. So I think this is just another sense of where we're coming from. But as we're thinking about this and we're thinking, you know, how do we really play a role here? It was really interesting to hear Dr. Bibbins-Domingo talk about the things they're doing at JAMA, and we are doing many of those same kind of things of really being more transparent about who our editors are, about who our board of reviewing editors are, really being transparent about the diversity of our reviewer pool and setting goals to try and change that. But at the heart of all of this, as we take these steps that are so essential, we have to we are maintaining a focus on scientific integrity. And what's been interesting is how little the public understands about the process of scientific integrity, the process we use for the evaluation of science. This is a quote, Walter Isaacson, who wrote the book on Jennifer Doudna. Holden interviewed Walter, and this is a quote he got: "I learned that the rigor and honesty of the review process is so crucial to the progress of science. And in an era that's become loose with facts and truths and skeptical about science, it's useful to have bulwarks that believe that evidence matters and intellectual honesty is our true North Compass point." And in another setting, I think many on this call probably know that Holden was invited to testify before the select subcommittee on the coronavirus. And what was interesting as we watched that play out was that he really did get to explain to them part of the peer review process, preprints, media coverage. And of course, you know, there were people who weren't going to listen either way, but this was a message that was at least some were hearing. And, you know, at the end, the members of the committee were saying, we don't agree on things, but to Holden, he has guts and balance. So sometimes this engagement, it can be productive, not always, but sometimes. So we see this sort of, you know, we have to stand up for science, and others have talked about this, and we see a balance here. There's clearly the, you know, obviously the two sides, where on the one hand, science gets attacked. On the one hand, we have to pay attention. Is there something that needs to be corrected? Is there a problem? But the light is shining very brightly on these issues of scientific integrity, as it should. But on the other hand, are authors being attacked? And if so, we need to stand up for them, which is part of what Holden did when he went and testified before that committee. And so we're trying, on the one hand, to give out the message, correction is courageous. If the paper needs to be corrected, let's correct it. Let's correct it transparently. Let's correct it quickly. Let's make sure the readers understand the process. And on the other hand, though, we need to stand up for science when, as Holden did here, if the science is being attacked, relentlessly, often attacked without grounded scientific basis for the attack, then we need to stand up for that science. And of course, as we publish more in controversial areas, that happens more and more. But then, of course, it matters who's doing the science, and much as Dr. Bibbins-Domingo said, we have to commit to a vision of the future where equity for women and people of color is prioritized, where leaders in Washington, D.C. represent the future, not the past. And as Dr. Bibbins-Domingo said, this is not just about equity, this is about doing good science. We really need all the voice. We need everyone at the table. These challenges are affecting everybody. These challenges are really challenging. And we're just not going to get there without having everybody in the room contributing. And we certainly won't be trusted without everybody in the room. So beyond this, what can we do just even beyond the journals? And one of the and some of the things are, maybe we don't do enough telling the story of science. Maybe we present the facts. We need to present more of the process so that people can understand the process of science. We need to teach the history of science. We really need to understand that at this point, we're doing science in public. And so it's part of the responsibility of the scientific community to tell the story, to teach the history. We need to value communicators and educators, because not all scientists are good communicators, and we shouldn't be expecting all scientists to be able to really tell the story of science, to present to a really broad audience. But there are people who can and are really, really good at it. So we should really value those people. We, of course, should acknowledge our own humanity. We're going to make mistakes, and when we make them, we need to correct them. We need to stop washing our hands of the politics. We need to, dive into this pool and swim. And we need to deal with our own internal problems, of course. We need to look for the sexism, the racism, the homophobia, the problems in our past. And I think one of the real motivations here is not to make ourselves better because we found what our predecessors did that was bad and we've acknowledged it, but really to learn from it and to look at what are the mistakes we're making now that could be looked back at in 50 years' time. How do we socially responsibly act now to change the society we're living in? Thank you.
Thank you. Thank you so much, Editor Vincent. I really appreciate it. It's clear from your presentation that the context is always there, whether we choose to acknowledge it or not, and not acknowledging it leads to bias that can do a lot of damage. And so to that end, I wanted to start off asking some questions from the audience that we solicited from before the session. And these are questions from the audience. We chose the questions that were most often repeated and were most salient to this discussion. And so I'll start off with the first question. The war in Gaza and resulting humanitarian catastrophe has provoked strong responses within academic medicine, as evidenced by the large number of questions submitted on this topic. What responsibility do academic medical journals have to respond to contemporary or historical political issues salient to health? I could pick, but
who do you want to start?
Yeah. Yeah. I'll let the host start. Editor Horton, would you like to start?
Okay. Well, of course, certainly from our point of view, war is a health issue. Injuries, deaths, whether by terrorists or by nation states, they are in some ways the most extreme social, political determinants of the health of individuals, communities, populations, and we should be engaged in that. You specifically cited Gaza and the ongoing conflict between Israel and Gaza, which now seems, with the news in the last 24 hours, to be extending northwards. Our position here has been that we wanted the journal to be a forum where physicians and scientists could exchange their points of view, their evidence, data, and to have some sort of substantive debate, recognizing that positions are very strongly, indeed often so firmly held as to be impossible to modulate despite evidence being brought to bear. But a journal's correspondence pages should be a place where these debates can take place. I said earlier that our goal is not just health, but health equity and social justice. And so only by working together and arguing together can we find, or hope to find, a common space for agreement. And the second role that we have, in addition to publishing, exchanging views, is publishing research. We publish one research on telemedicine to support trauma care in Gaza, and to publish editorials and opinions that the editors may have. And we've done several of those over the last year or so. So I think journals have to be engaged. It's absolutely core to what we do, and certainly a moral imperative.
Okay.
I would let me jump in. I would agree. And JAMA has a long history of having a series on health during times of war, and have published on this. I think it for Gaza in particular, it is an important health issue of our time. It is also one that is affecting so much of our medical and scientific communities and academic communities here in the US as well, right? And so I think that if I would say where a challenge is that in the midst of a conflict that is oftentimes moving and dynamic, a weekly health journal being able to be up to speed and to allow the voices. We're trying to publish mostly the voices of authors who are coming to us. We could devote all of our pages to the importance of this conflict, and yet we have other things that we also have to do. And so I think the pace, the enormity of it means that we are often disappointing people who would like us to do more, to write more, to publish more. And so I will just acknowledge that that's a challenge. But I do think this is a space where certainly historically we've been in a JAMA. We also have in this conflict, and I believe for the U.S. journals, most have stayed out of this, to be perfectly frank, and I think we have tried to do that, and it is as Editor Horton said, it is an area of strongly and deeply held views, and so it is part of our responsibility, and it is one that we end up spending a fair amount of time thinking about how to do this well.
Yeah, and I think most everything that's been said we would agree with, and in a similar way we would certainly be looking at research that is public health in Gaza, but it's pretty early days and pretty difficult places to work right now. We would also be looking at letters that come in and I think the one interesting thing to say is that when you get these controversial situations, we get some really interesting evidence-based letters, responses. You also get a lot that's really not. That's people trying to use, the voice of science to say what their opinion is. And so a lot of what our task is to really look for whether this is an evidence-based piece that would be something that is of value to that has scientific value.
Yeah, I mean, I think all of your responses are very interesting, new information. I would say Gaza is not the only controversial issue that is salient to scientific journals, and it is rapidly moving. But so are those other controversial issues, such as bodily autonomy in the United States and terrorism in general. And so there are plenty of different topics that are quite controversial that a lot of people believe that journals are not talking about enough. And so where do you draw the line? In other words, how do your respective editor groups decide whose viewpoints and which research to publish on controversial issues?
I'll start. Again, you've set it up nicely, Dr. Mensah, by saying there are a lot, and we always have a limit to the number of pages. I think that one thing that was clarifying for me, so I started as editor-in-chief right after the Dobbs decision in the US. And when I started, it was, it was like, what are we going to publish in this area? Maybe this is too controversial. That was a conversation we had. A clarifying thing for me is that since the core of, historically, the core of JAMA's audience has been a clinical audience, that if these are issues that are affecting the care of patients, these are squarely issues that we should be publishing on, even if they involve something that might be controversial on the political landscape. If it involves the care of patients, the health of patients, especially for our clinical audience, that is squarely in our lane. And I think that has been very clarifying for us, because then it is not, are we wading into a political debate? It is, there's this external reality that does affect how we take care of patients. And so I think it is also how we've thought about within the time of war. We're really talking about the health issues as they relate to wartime. That is another lens through which we look at it. It's not always easy, but that is a framework that we have used to think about what we might publish on and what we might not.
Yeah, I think I would also say, yes, there are many controversial topics. And I think, part of what we are looking at is this going to move things forward? Is it going to be productive to publish this now? But the one point is that often the politically something is way more controversial than it is scientifically. So sometimes what we're doing is, if you looked at the one editorial that I showed in my slides was from it was published when Roe v. Wade was first getting reconsidered by the Supreme Court, and we were still hoping for a good outcome. And the editorial was from a woman who was the lead author on a study that looked at, how abortion affects the health of women. And so there was some real scientific evidence to bring to this debate. And that's what that editorial tried to point out, that actually there was plenty of evidence that the ability to have an abortion was a good thing for women. So I think sometimes that's our role, to bring the science into the debate, especially at science, where that science may be known by a few experts that are directly in it, but the political debate is way broader than the few people who know the science, and the science often gets misrepresented by for political reasons. And so what the one thing we can try and do is really present the science.
Well, just very quickly, I think your question was about how do we decide as editorial groups, and the answer at the last is it depends what sort of piece you're talking about. So we have twice weekly manuscript meetings where we discuss papers across the entire group. And so all editors can weigh in and criticize a paper at the Weekly Lancet or at one of our sister journals. If it's an editorial in the weekly, then we have an editorial writing group, a leader writing team. We meet once a week and we argue about what we're going to say. And then when the draft has been written, we argue again with each other about what we're going to say. And we're arguing until the moment we press the go button on a Tuesday. And then if it's a letter, well, then it's the correspondence editor and myself. So, you know, there are various levels at which we decide. And probably that means you can imagine that there's a sort of, when you have lots and lots of people involved, then perhaps we're a bit more conservative because you regress to the mean of the group. And then when it's the correspondence editor and me, well, those are often the liveliest pages because we say, hey, we really want to publish that because it's an important point of view, and maybe it is a little controversial, but we want to be in that space.
Right. I appreciate all of your answers, and I think one might say that journals' role with regard to controversy is to resolve controversies of fact and bring evidence to a discussion that is certifiable and true. And so I think when journals don't publish on these issues or publish less on these issues, it can look as if there isn't evidence of what people claim to be happening. You know, so I think that's important. The next question was asked is basically an empirical analysis of articles published in JAMA, The Lancet, and 3 other journals from 1990 to 2020 concluded that only 0.9% of articles included the word racism, and very few of these of that 0.9% were research articles. So how would you respond to scholars who claim that your journal refuses or is reluctant to evidence the role of racism in health inequities? Editor Vincent, if you want to go first.
Oh, well, we're not, I actually haven't looked that up for us. I don't know what it is, but I would say that we're much less of a health journal, of course, but that's exactly the kind of paper that we want to publish. And, you know, if you look at our past, you know, maybe there are times where it's been avoided, or I don't know. But we do look back, but it's very hard to say what you were trying not to publish. So, but at the moment, those are exactly the studies we would be looking for. We would be looking for studies that address, you know, the impact of disparate healthcare. We had a paper, I believe, just a few years ago, where we really looked at the way algorithms were influencing healthcare that people received, and there was a systemic bias in there, so that which, you know, was basically racist, that people of color were getting recommended healthcare less than white people. So I don't think it's something we would shy away from at the moment at all. In fact, anyone who's beholden would think absolutely not. So I think it's really what we're looking for. And I love what the Lancet is doing, because it'd be great to be doing more to actually try and encourage this, to actually say this is the work that should be getting funded, because the real problem is getting the funding to do work that's directly addressing these kind of issues, rather than just having them come out through other studies.
Yeah, I think that the goal of a journal, that the challenge for looking at a statistic like that is that it also reflects the lack of attention to those issues in the academy. And so the journal, it is not necessarily only the failure of the journals to take high quality scholarship. It's also failures of funding scholarship in those respective areas across the academy as well. And but I'm sure it also reflects editorial decisions at the journal to say this isn't necessarily the type of science we want, or those types of things. I think one of the things that we have focused a lot on is not just thinking about the science that includes racism as a factor that relate to the types of outcomes that we see, but also when we have a paper that is not necessarily focused in that area, that we prompt the discussion either for that author group to raise those issues in their discussion or in the editorials commenting on that paper. It's the way I think we have to do much more of, is to be a forum for the broader discussion that includes many voices, many types of scholarship talking about a particular issue, not just saying, oh, well, we don't publish those papers related to racism, but to say we have this health state that we're trying to understand. Let's unpack the things that are contributing to that, both with the voices from the authors in the original investigation and through many other people who are talking about what the phenomenon is that we have science related to. So yes, we have to do better for sure.
Well, let me first acknowledge the fact the Lancet was founded in 1823, and in its very opening editorial, it made very clear that one of its target audiences was, and I quote, colonial practitioners. So the Lancet was born in a colonial era, and indeed was an instrument of colonialism, and some might argue that it's still an instrument of colonialism. It's as an organization, I can't tell you how profoundly we were affected, and I'm sure this was partly because we were in the middle of the pandemic as well, and which meant that everybody was working remotely and we weren't together. But the murder of George Floyd definitely was a transformational moment for the team that is the 200 people or so who work in the Lancet group. It changed us dramatically, and it raised the issue of racism in our society and touched us in a way that I can't think in my 30 years at the Lancet an event has done so. Immediately after that, we, like many others, responded with statements. We set up a group for racial equity within the Lancet, and that group has been working hard over the past several years to set up its own international advisory board on race and ethnicity. They've done a series of initiatives at the Lancet to raise the issue of racism in the work we do. We published a theme issue on racism in healthcare in 2022. We now have 3 commissions ongoing on racism, structural racism globally, one on structural racism in the United States and one on racism in child health. So a lot has changed just in the last few years, but I think racism operates at multiple levels, and we want to be very careful to not be complacent still. At its heart, racism is discrimination, and we all claim, our 3 journals, to be international journals. We all believe that we have some sort of international relevance, but the honest truth is that we're not doing that, because we do not represent in our pages the interests of all human populations. And we can say, and it's a perfectly reasonable defense to say, well, there are others who shape these issues, funding bodies, governments, and so on. But ultimately, it's our responsibility what we put in the pages of our journal. It's not somebody else's responsibility. It's not the Wellcome Trust responsibility what goes in the pages of the Lancet. It's my responsibility and my colleagues' responsibility. And if I choose not to publish papers about global health issues and what's going on in Africa, that's my judgment. And if I don't, I'm party to that neo-colonialism, that ongoing racism. So one of the issues that it's always in our mind, and why we're so committed to these global health issues, is that that's part of what you have to be if you're concerned about the planet and the world, that you have to make space for these issues. I can remember once receiving a photocopy. It was from a doctor in the United States. It was a photocopy of a front cover of the Lancet. And the person, I can't remember which part of the States it was from, but he basically wrote, "We are not interested in malaria here." And because we published a bunch of articles about malaria. And that may be so. Maybe if you're in Chicago, malaria isn't your #1 concern if you're a physician working there. But we're trying to appeal to the sort of reader who is interested and concerned about the interdependence of human beings across the planet. Because unless we understand that your health matters to my health as much as my health matters to your health, then we really have learned nothing from COVID-19 and from any other crisis. So this is a mission that we have to keep pushing very, very strongly.
Well, I appreciate all of you. We're way past the hour, so I appreciate all three of you coming on and doing this. On behalf of the Lancet Commission for Public Policy and Health in the U.S., I want to thank editors Vincent, Horton, and Bibbins Domingo for accepting this invitation. This was quite a conversation, and I'm happy we had it. Thank you to Dr. David Himmelstein and Dr. Steffi Woolhandler for their wisdom and support throughout. Thanks to Adnan Habib, Ethel Rojas, and Brian Vaughn for their help. And finally, thank you to our sponsors for making this happen. It couldn't have happened without you. So thanks everybody for joining this talk. It was quite revealing and informative, and have a great Friday.
Thank you very much.
Thanks very much. Take care.
Bye-bye.